All right, let's dive right into the heart of what nurses do. We're going to talk about how they make those critical life or death decisions, sometimes in just a matter of seconds. It's an incredible skill that's part science, part structure, and, part a really unique kind of wisdom. So, picture this, a chaotic ER or super busy hospital floor. A patient's condition suddenly takes a nosedive. There are a dozen things that need to happen all at once. So, how on earth does a nurse decide what to do first? What's the absolute top priority? It's not a lucky guess, I can tell you that. The secret really lies in this powerful combo. Think of it like this. Nurses have a reliable blueprint that guides every single action, but they also have the skills of an expert builder who knows how to read that blueprint and adapt it to what's happening in the real world right now. Let's break this down. So, first up, let's talk about the blueprint itself. This is what we call the nursing process, and it is the absolute foundation that brings order and sense to the incredible complexity of patient care. So, what is it exactly? Well, you can think of the nursing process as this organized, systematic way of solving problems. The keywords there are organized and systematic. This isn't just a random to-do list. It's a very deliberate, evidence-based way of thinking and acting that guides a nurse through every single stage of care. And this whole process has 5 main phases. First, you've got assessment. This is where you're like a detective, gathering all the data, all the clues. From there, you move to diagnosis, where you analyze those clues to figure out exactly what the patient's problem is. Next up is planning. You create your game plan. Then comes implementation. You put that plan into action. And finally, and this is so crucial, you have evaluation. You step back and ask, did it work? And then you adjust the plan based on the answer. Now, I want to pause on that diagnosis step for a second, because this is a really important distinction. See, a doctor makes a medical diagnosis, which focuses on the disease itself. So they'll say, this patient has pneumonia. A nurse, on the other hand, makes a nursing diagnosis which focuses on the patient's response to that disease. For example, ineffective airway clearance. That small change in focus is a huge deal because it directs the specific hands-on care that nurse is going to provide. And you got to remember, this whole thing isn't some checklist you just run through once and you're done. No way. It's a dynamic, continuous loop. What the nurse learns in the evaluation phase feeds right back into a new assessment. And that's the real magic here. It's a built-in engine for constantly improving care for that patient, moment by moment. Okay, so if the nursing process is our blueprint, who's reading it? Who's bringing it to life? Well, that brings us to the builder, clinical judgment. This is the active, thinking human skill that makes the blueprint work. So what is clinical judgment? It's basically the outcome of all a nurse's critical thinking. It's the mix of cognitive, emotional, and even behavioral processes they use to make decisions. See, it's not just about knowing facts from a textbook. It's about applying those facts under pressure in a messy, complex human situation. So what is this expert builder actually doing all day? Well, they are constantly picking up on subtle cues from the patient. They're looking at lab results and interpreting what they really mean for this specific person. They're constantly prioritizing what needs to happen right now versus what can wait. And just like with the blueprint, they're always reflecting on what happened to get better for the next time. And, nobody is just born with this skill. Clinical judgment is something that's built, it's honed over years, through school, through countless hours of hands-on experience, through amazing mentors, and through the personal discipline of always looking back and asking, what could I have done better? Okay, so we've got our blueprint, the process, and we've got our builder, clinical judgment. So the big question is, how do they actually work together? Well, the source material just puts it perfectly, and I love this quote. Clinical judgment and the nursing process are intimately linked. They're not two separate things. They're two sides of the same coin. You really can't have one without the other if you want to provide safe, effective care. And this really breaks it down for us. The process, our blueprint, gives us the structure, the systematic steps, that solid foundation. But it's judgment, our builder, that provides the context. It provides the ability to prioritize and the flexibility to adapt that structure to a unique human being. The blueprint can tell you how to build a house, but it's the expert builder who knows how to adapt it to the specific piece of land you're building on. So, how does our builder actually use that judgment to prioritize things in the real world? Well, they don't just rely on a gut feeling. They have a whole toolkit of proven, practical frameworks to guide those tough decisions. Because let's be real, in a hospital, it can feel like everything is a top priority. These frameworks are like mental models that help a nurse cut right through the noise and focus on the one thing that's going to save a life or prevent serious harm. Probably the most famous tool in the kit is the ABCs. It's so simple, but so powerful. First, A for airway. Is the patient's airway clear? That is always, always priority number one. Then, B for breathing. Are they breathing effectively? And finally, C for circulation. Is their blood flowing and getting to where it needs to go? Airway, breathing, circulation. It is the absolute bedrock of emergency care. And the ABCs are just one tool. There are others, like Maslow's hierarchy of needs, which reminds nurses to take care of fundamental physical needs, like breathing or hydration, before worrying about higher-level concerns. And then there's a constant focus on safety, always thinking one step ahead to prevent things like falls or infections or medication errors. It's all about what's most important right now. So we have the process, the judgment, and the tools. But what's it all for? What is the masterpiece they're all trying to build together? Well, the answer is incredibly simple. It's all about patient-centered care. Everything we've discussed, every single framework, every phase of the process, every single moment of judgment, it is all aimed at one single unifying goal: the health, the well-being, and the safety of that individual patient. That's it. And when that blueprint and that expert builder are working in perfect harmony, this is the beautiful result you get. You get problems identified early, before they become disasters. You get care that's tailored specifically to that person's needs and their values. You get efficient communication across the whole healthcare team. You get care that is fundamentally safe, effective, and fair. That's the masterpiece. So, here's the bottom line. The nursing process gives you the essential structure. Clinical judgment gives you the indispensable wisdom. And when you put them together, that's the foundation of expert nursing. So the blueprint and the tools are there for every nurse. The real question is, how will you use them to build your legacy of patient safety?